We're gonna get going. Commissioners meeting Wednesday, April 2nd, 2025. All commissioners are present. We're going to move forward with public comment. Nope. Gonna move on. Elected officials and department head updates. Cheryl, I know that you've got some things listed. Is there anything else that you have today?
No.
Alrighty. Doug, do you have anything today?
No.
All right, then Catherine, you're here. Do you have anything that you're gonna not talk, that's already a plan that you want to talk about? No. Okay, then we're gonna keep on moving on. So first up is scheduled items, master agenda item 1252, semi-annual report, Maplewood. Catherine Kindop is here. Action expected to receive an information report on the last 6 months of operations from the Maplewood administrator. You should have received this also in your packet.
Yeah.
Catherine.
All right, so I'll just go over a few areas, but please feel free to ask, stop with questions anytime. Just overall from regulatory requirements, something that's very frustrating to us operationally is some pandemic era rules continue to impact our operations. Specifically, the lengthy out of work rules continue to impact us. So a staff person with pandemic illness, a COVID illness, has to be out 10 days.
Is that across medical facilities, all medical facilities, nursing homes, or businesses in general?
Purportedly it's across medical facilities, but I understand with friends in the hospital setting, it's not. How do I put it?
Enforced?
Thank you. Just to remind this group of commissioners, that was a county facility about 2 or 3 years ago, who permitted a person to come back within 10 days. And I don't remember all the details, but I don't think the person had any signs and symptoms. But they were so short in their staffing that they brought this person back before the 10 days was up. A complaint was lodged to Health and Human Services, who came in and put them into an immediate jeopardy situation and fined them a 6-figure amount. So it's very punishable, and so it's still absolutely imperative that our staff report any reportable illnesses, including GI, respiratory types of things, and then we have to do testing.
Is, just for my knowledge, is CMS have as much oversight over hospitals as they do over this type of facility? Because it seems like a lot of the directions, a lot of the ways that you have to do your business is through CMS and Department of Health and Human Services, but CMS specifically.
So I don't understand completely how CMS oversees hospitals per se. I do know that the same surveyors that come into here also go into hospitals. I know hospitals really focus more on J-code, if you're familiar with that acronym, in terms of their making sure that they're meeting all standards, but CMS, the rules that they have created for nursing homes, we jokingly say they've superseded the nuclear power plants. They truly have. If you look at the rule book for nuclear power plants, you look at the rule book for nursing facilities, we really are the most highly regulated, and it's a very punitive environment. So we're held to a different standard, and in fact, it's my opinion, we're held to a higher standard. So I wanted to keep putting that in there, that in terms of ongoing reporting, we have mandatory weekly ongoing reporting that still has happened. And it used to be that if we didn't meet the weekly reporting requirement, we could be fined $10,000 a week. The fine has been lifted, but it's an instant service deficiency. The moment we miss one weekly report, it's an instant service deficiency. So I have 5 staff, including myself, and one of the staff persons that is knowledgeable and able to submit this report through to the CMS to make sure that it's continuing. The report itself has really gotten a lot smaller, so it's not as thorough, it's not as difficult to get through, but it's a nagging need for us to do something that we could sum it up and be more effective and efficient, but every week somebody has to go into this special, repository and add this information. So I wanted to continue to talk about that because it does impact our business. And while the rest of the world has gone away from the pandemic, nursing homes in the state, in the United States, it's my opinion, we're still under really, archaic rules.
So what can we do? Age can we rattle or whatever to get anything done? Change it.
The cages to be rattled are really through either it's federal, like these are federal rules. So it's either through our NACO or our American Healthcare Association, those kinds of memberships. But I'm gonna be honest with you, with regards to what's going on that we need to put our time and effort into at the state level, but also federally. This is such a small piece of our concern that it's really only I share it with you as a frustration for operations. What we really need to focus on is making sure we don't lose Medicaid monies, or in the state of New Hampshire, make sure we're continuing to focus on the Medicaid applications, and I've got that in here as well.
Yeah,
So,
and we've brought this forward before on multiple levels. Center for Medicaid Services is its own beast. It's almost separate from the government on some levels. It's not even housed in DC. It's housed in Baltimore, if I remember exactly. And they only got, I think, more power during COVID due to some of the outbreaks in nursing homes that you heard about all over. And then there were some floods where they were down south and stuff where there were some situations that occurred in nursing homes. It just seemed to embolden them even that much more. And I mean, literally, Catherine and her staff have to take months every year to go through all the rules changes every single year with what they do. And it's just, we're more, in my mind, have more oversight over us than hospitals do on some levels with the level of expectations, especially when it comes to the Center for Medicaid Services. But we will continue to have those discussions when we have with our elected officials. But it seems to be that the only way that real change would happen is if somebody really just changes the way they do their business there.
In the meantime, whatever support you need from us to help you do that job and to comply with all that stuff.
thank you, yeah. So in my next segment, I talk about our quality assurance process, and it's just another requirement that we always have to do quality assurance meetings. We do monthly meetings, but quarterly we do a very robust meeting. Commissioner, you were present the last time. The next one's coming up, I believe it's April 29th. It would be an 8 o'clock start. We start with corporate compliance and then go to our quality process. And then that's the day that we arrange that the commissioners meeting starts at 9:30 instead, to allow an opportunity for a commissioner to be in attendance. So we do that in part because it is a requirement, but in part that is our process for when we do audits, we find things that aren't either meeting rules or they're not meeting policies that we've set forth. That's where we can bring it to the table. We can talk about what we need to do, maybe do a little problem solving, but it really is meetings where those minutes are not public, they're not something that the surveyors can take a look at, because it's us airing out our challenges and what we're focusing on. And so within that, we always have to focus on what's called PIP teams, which are, performance improvement practice teams. So at any given time, we always have to have several teams on the go. So I just listed some that were on the go in the last half of the year of last year. You mentioned the rules, the next 900 page of rules were dropped on us a few months ago, and they're set to go in effect at the end of April. So I've got a big committee going where we're dissecting all of the rules, trying to determine how it's going to impact our operations so that we can understand what they are, educate everyone as to what we need to do, make sure our policies are in conformance with them, and then we'll have to do audits and we're meeting those standards.
Yeah, and I just want to say that, I was just notified too, I'm now, a sitting member on the health committee for, NACO. And, they're having a meeting coming up and, I'll bring that up here, but the problem with it is that not every, and there's only a few states that have nursing homes or elder care in their, that's what they do, you know, they have a much bigger, thing that they look at and so it's, but I will bring some of these concerns forward too.
In fairness, there's not a lot of lobbyists that get up to the federal level. And CMS, I've jokingly, but literally seriously called it the untouchables for
Yeah.
over a decade now. I've talked to the folks with Shaheen,
Custer.
Custer, anybody that will listen, I've spoken to, I've written letters, but whether it's the CMS or CDC, they really are untouchable. I was actually very excited because back in October or November, I saw that I don't remember the acronym, but the group of individuals that determine what's gonna happen with regards to whether it's immunizations or some of the rules that we have to follow on how long we have to isolate and keep away from folks when COVID happens to healthcare workers. I was so excited because they were gonna reduce it to about 3 to 5 days. But that was about October, November. It should have already happened by now, but between what's going on federally, it looks like CDC is really getting cut up into pieces. It looks like CMS, through Health and Human Services, also being impacted. So our hope that we would get some of the lifting of the rules, in fact, it's like we're in a dead zone because we're being told all these rules are going into play. It looks like the governing bodies are being gutted. So there's nobody to give us updates or tell us, "Yeah, don't worry about it. You can go ahead. You can get people back to work if they're not sick after 3 days." But on the other side, the threats and the fines those are true and those are real. So unfortunately, I have to keep managing this facility with all of what we believe is happening until we know. As part of the new rules that came into play, we had to completely revamp our facility assessment. So that was something that, the former Commissioner England had been part of because they did ask for somebody on the governing body to be part of that. We did complete that and we were surveyed on it. The surveyors didn't give me any feedback, so I hope that we've met their expectation, but I don't know.
So if you don't hear anything, that's a good thing.
It may be a good thing, but what happens with our surveyors that they're state employees, but their role is to make sure that the federal CMS guidelines for Medicaid and Medicare are being followed by us. And sometimes what happens is we'll get these, like this year, the 900 pages of the regs. If they're not taught and given guidance on how to adjudicate us on them, we interpret them, we practice what we believe is supposed to happen, and they could sit there and go, yeah, it goes way off base, but they cannot give us that feedback. And so we could be practicing incorrectly for a year or two before they get their official guidance on how to determine if we're doing it correctly. So what's difficult is things that we've analyzed and put into practice, say a year or two ago, we might get a deficiency in a future survey, and it's really not expected because we don't know. Just one of the strengths about being in the county system is that the county nursing home administrators, our affiliate, were very active. So for example, yesterday morning, David from Hillsborough County emailed to all of us saying surveyors just walked in. So what happens is we're all on the lookout. If he says, hey, do you have a policy on this? Or hey, what do you do with this? All of us are going to come to his support and make sure we can help him through any challenge that might occur during the survey if he needs to reach out. But when he's done, at the end of yesterday, he gave us a synopsis. So what I've done is already forwarded to my department heads and said, hey, go take a look and see if these conditions are something that exists here. This is how the surveyors are looking at it. So by always having that open correspondence, we can make sure we learn from one another and understand what's going on so that we can try to prevent that same issue from happening. And that's really one of the reasons why the state of New Hampshire for years has had a great reputation for having low levels of deficiencies. In part is because we communicate so effectively. As a matter of fact, between the counties and the healthcare association, with just a couple of keystrokes, we can push out information to almost every one of the 72 to 74 nursing homes instantly and share that information so we can share best practices. And that's in part why we can do so well with our surveys. It's not perfect, but
Yeah, so it goes back to CMS makes global or overall policy based on the country as a whole, where New England, first and foremost, but New Hampshire even that much more, has some of the highest ranking care of level of care, lowest level of deficiencies, and lowest reimbursement rate. So we do it very well with very little money coming back from the state, or feds, because it's the lowest Medicaid reimbursement rates we have, but we do it with the lowest deficiencies and the highest level of care. But they make policy for everybody. So Minnesota, so Alabama, Mississippi, the Florida, whatever it is, we're getting nailed for what they're not doing.
Common problem with
Mhm,
regulations at a high level like that.
mhm.
although speaking of regulations, one of the things I wanted to mention was locally, so the state of New Hampshire also regulates nursing homes and assisted livings. So in fact, assisted livings are not currently federally regulated. In the state of New Hampshire, it's called the 805 rules, and for nursing homes, it's the 803 rules. And last January, so a year and a couple months ago, when I happened to read the proposed new 803s, I was immediately alarmed. There was a segment in there that would have required us to do what's called, they used to be called these abuse checks. I don't know what the current acronym is. It's the Bureau of Elderly and Adult Services. It's changed its name to BAAS, but what it is pre-hire. We need to make sure we don't hire someone on this particular list. To get on that list, I believe you have to have been known to have harmed in some way some vulnerable person. So in addition to the criminal background check, in addition to just so many different checks we have to do, there's this one called the fees check. It has become more difficult to run. At this point, to do one, let me give you an example. If I were to hire you, at one point I would be saying to you, we're gonna have to put you through this fees check. I'm gonna need your email address. You're going to get an email from this entity that you're gonna give some personal information on. So that you're gonna let them know what you need to let them know, so that we can know if you're on this list or not. So here's the thing, we still hire folks that do not have personal email. So there's a barrier right there.
Mhm.
And
So there's no list that you can just go look at. You gotta go through something. That would, um,
the list is known. It is one list.
but it's not accessible.
No,
Um,
that is why I push back. I don't mind doing this on a pre-hire basis, but there was gonna be suggestions that we do it on a prescribed periodic basis for all staff. That would just bring a lot more of an administrative burden to us. Now, here's the background. The reason that our state wants us to consider this is because when a person is being assessed to determine if they've maybe done something that's harmful against an elder, they have their due process. So it might take a few weeks for this to happen. So in the meantime, say they get terminated from another area nursing home and they come knocking on our door and it's before the process has been completed, we can do this check and it can show up that it's fine. And even the folks have told us that they get the check and they're thinking, oh, great, we're getting the ruling on it in the next couple of days. They could have a clear check today, but within another week or two, it could turn out the opposite. Now, one of our questions was, well, then why can't you tell us? You just saw that Maplewood Nursing Home asked, could they hire Skip DiBernardo, just in this, make believe.
So instead of going through this 803 process, whatever, can't you just ask the question on your application, and if they lie, then you have, and that's, you can fire.
Yeah, no, we do that, and there are terminable offenses based on the application, 100%.
Right.
The problem with this is that if they've not had a finding against them, they can tell you, I don't have a finding against me, and they're being honest.
Yeah.
But what's so frustrating is the folks that manage the list, they know, they can see, oh, look at that, maybe we'll ask about that person 2 weeks ago, and now there's a finding on that person. So I understand why the state would like us to go through this exercise. But I did some grassroots efforts and got to the point where I had a lawyer from DHHS, I had the folks that are making these rules, I had folks from the Healthcare Association, I had a bunch of administrators. We were trying to talk to all of them to say, how can we make this process a good process? Such as, why can't we turn it around? Make the list available for all of us to check against the list.
Yeah.
No, because personal freedom, everyone has the right.
Well, it's the same, you mentioned the lawyer list, it's sort of the same safeguard there, only judges can look at it.
So that's the conundrum that we've been hitting up against. So the administrative burden is significant, and that so far we've been able to push back on the state. I don't want to hire someone who's on that list, don't get me wrong, but you can't, in my opinion, make a rule that creates so much administrative burden. I've been here 30 years, as you know, and I've just seen time after time all these rules that increase administrative burdens. And now I'm too old. I don't care as much, and I am fighting tooth and nail against any additional administrative burden that has no funding for it. So I have pushed hard and back on that, and I will toot my own horn. I was the only one in this state that caught on to what was being proposed. So I kind of led the bandwagon on this, and I'm quite pleased that at this point, we've pushed back and it's not in there. It's,
Good for you.
I'll keep watching for it, because I am done with administrative burdens that are not financially supported. And that's all I have to say about that.
I support that. If any authority to do anything, yeah, or yell at somebody if you want.
So just moving on, we did our 2 disaster drills last year, which is a mandatory requirement, and our second one was the cybersecurity disaster drill. I'm very anxious to talk to folks and Stratford who've just gone through the real thing. I haven't had a chance to talk with Ray, but I'm sure it was really fun.
Anyway,
We put the pharmacy contract up to bid and we brought it in front of you, and actually, no, I guess that was the prior form, Commissioner's pardon. Our new pharmacy went into place in February. It was actually a very smooth rollout, so it was very good. I'm gonna just put an interesting piece on about our wheelchair van had its annual site visit during that last half of the year. But what's interesting is a little bit further, I talk about how the state of New Hampshire at one point in time told us that our wheelchair van is gonna have to be licensed the same as an ambulance. And so we did all the required documents, we sent them in. I heard nothing, talked to the Department of Safety that was doing this, talked to the head honcho. Oh, we lost track of it, resent them again, heard nothing. So we've been waiting for 2 years on this, and finally, this, the end of December into January, finally, we've got an understanding that because Maplewood only does sole source transport, so we only transport our own residents, whether it's the nursing home or assisted living. DOS has determined that, no, we don't need to be licensed as an ambulance for our wheelchair transport. 2 years.
Quick victory, right? 2 years.
Yes, so those are just, that's very typical for things, you know, we're told we have to adhere to something, we do all the groundwork, all the administrative pieces, then we wait.
so that exception is not in their fine print somewhere?
Not that they were ever able to tell me, and I talked directly to the commissioner, so. We did our annual hazard vulnerability assessment, although we'll have to do it again in July, and our focus will have to be on the bridge, so. Because, we always have to analyze what are the largest hazards that would impact us, and then make sure our disaster drills are focused on those. Frankly, it's going to happen, that we're going to lose Partridge Brook at some point before the new bridge is constructed. So we need to just be on the ready and have that drill.
Well, the solution there is buy a helicopter.
I have two questions. We skipped over activities held on Carnival Day and annual craft fair.
Sure.
Are those things that crafts that the residents make, or you just have a outside crafters come and do a community thing where people come and see this place?
So it's a little bit of both. The history behind the annual craft fairs, we do have residents that do try their hand at craft. Sometimes they're not highly resellable, but it's a really good activity for them for a lot of reasons. And sometimes there are some pieces that can be put into a place like this. One of the reasons that we hold those is we always have to show what are we doing to make sure we're bringing the community to Maplewood. It's actually literally part of an expectation. So by hosting an annual craft fair, having crafters come from outside, having a little bit of table for our own residents, it allows our residents to maybe go down and get things for their loved ones so they can surprise them for Christmas. Because residents here, for the most part, can only keep $74 a month from their social security checks, so they have a very small budget for their loved ones. So that's what, the reason that we combine it is honoring the residents and what they can do, but also honoring the fact that residents would like a little bit of the community to come here to do that.
Right, they don't have as much access to the outside world. That's awesome.
And the Carnival Day is always a huge deal. We usually have to do, set 2 dates, and it happened this past year. If the weather isn't good enough, we always have to push it back, and that's what happened this year. We try to get as much staff involved as possible, despite, we have to run the operations, but we try to get as much staff as possible off the floor and come down and run games and get as many volunteers as possible and try to get all the residents down. And we have things like cotton candy and, all those really unhealthy snacks for the day, but also have like games that are appropriate for them with whatever their challenges are. And generally, we also have animals that come in, like alpacas or miniature horses or ducks, so that we try to really make it a fun day for the residents.
Thank you.
Yes, please continue asking questions. I'm just gonna hit some of the highlights. Speaking of vulnerabilities, Legionella, we do have a Legionella policy. We've got a water team. We've been analyzing that for, gosh, I wanna say about 7 years now, but it's been in the news a lot. So we want to make sure our prevention of Legionella policy is always as up to speed as we understand it, whether ever new information is out there. We've done a couple of tests here and there. It is not a requirement to test for Legionella. And it is difficult to test for it, but with our own water and wastewater management treatment plant, Rob is very much able to help us with that. So we did do a test. I cannot recall what, but during that 6-month period, which is obviously fine, but it is a focus for obvious reasons. It's been in the news a lot. The Christmas pageant, I highlighted that on this because this past year was the first year since the pandemic where we did our traditional pageant in our meeting rooms where staff, again, we asked them to participate. They get all dressed up. We have beautiful costumes. We dim the lights. We have candle lights, like little, not real candles, but those battery operated. And we do the true pageant. We have somebody narrating it. We have a little choir. We sing all the songs. But this was the first year since the pandemic that we were able to put residents in the room with us. Because we couldn't even hold it for a couple of years. And then the year before we did it, we used our closed circuit TV to bring it to the residents. Unfortunately, Christmas tends to be one of the highest risks for respiratory infections, whether it's flu or RSV, it doesn't really matter. So it is difficult to gather all of our units together without the risk of outbreak. Or even noro. We've struggled through noroviruses in distant year past that have impacted our Christmas pageant, but we went for it this year and no outbreaks. It's very exciting. As you know, Sabrina Priest has successfully completed all of her requirements and she is now a licensed nursing home administrator. So we've got two here, which is a really good position to be in. We had our survey, we had 4 minor F tags and 2 minor K tags. No E tag deficiencies. And we had 2 LNA classes in that last 6 months. We graduated 8 new LNAs. Some of them we kept, but some of them, they come from other places and they go back to other places. They would actually, if they're doing that, they pay for it themselves, but we host the class. During that 6 months, we were updating, working on our next collective bargaining agreement, which was just decided upon last Monday, so that's good. We have another 2.5 years before that has to come back in front of us again. I'll just make mention, we had a Medicaid revalidation audit where the person came on site and he was very pleased with what he saw. The only feedback he gave me was in the administrative burden. We have these checks called the OIG Office of Inspector General checks, so pre-hire, pre-starting of any contract, we have to make sure that an entity has not been determined to have defrauded the government. So for example, our new pharmacy provider, I had to check with the OIG to make sure they didn't show up on that check. And our HR department has to check all pre-hire staff to make sure that they also aren't personally on that. There's an OIG and a SAMS check, those are 2. But specifically to the OIG, we do it pre-hire, we do it annually on all staff. With regards to our transportation aids, we've always been required to do it monthly because of the contract for doing the non-emergent medical transport. So that's the baseline of where we've been at. However, the Code of Federal Rules did increase the requirements on the OIG to monthly. So now, after this was brought to our attention, our HR department has to put all of our staff through monthly OIG checks, and my executive assistant took all of our contracts through monthly OIG checks.
What's involved here?
That one's very simple, so it's not a huge deal compared to what I mentioned a minute ago. This one, you can actually put up to 6 names in a specific federal database, and it will immediately give you the feedback.
There's cost.
No, so this one is not a huge time. It is a small burden, but compared to the one I mentioned earlier, where you have to get that staff person to do the initial piece, this one we can completely control. So we just set a calendar, put all those names right on here, because we can put 5 and 6 at a time. We can get through it pretty quickly. So that was the Medicaid audit. And then we had someone come in from CMS to do an inspection. And if you picture a young man in shorts and did not present well and demanded to come in, showing a little piece of paper saying, you have to let me come in, I'm from CMS to inspect. And traditionally, when people do that, they give us things we can photocopy. No, you can't have this, you can't take a copy of this. And he comes in poorly dressed and demands to be let into the building with a camera.
So where did you actually forward a complaint after that?
So what we've learned was that this was what was happening everywhere. And the same guy showed up, and every nursing home had this exact same experience. And there's nothing you can complain to. We can let the Boston Regional Office know, but the Boston Regional Office sent him.
Maybe they didn't know how unprofessional he was. Maybe when he interviewed, he looked good and then he went out in the field and flip-flopped.
And, you know, we've had free staters that come in with cameras and they're in your face, and so who's
And
to
you
say?
don't know if
Who's
this
to
guy
say,
was
you
a
know?
risk because he was just crazy.
Right,
There's nothing that says that he was who he was.
correct.
Well, he flashed an ID, and at this point, I had kind of heard something about it, so I had prepared my team. There's some inkling of something going on. So sure enough, on a day I was, I think, in Concord, I learned that, yeah, we got our little CMS inspection who did exactly what he did everywhere else. So, between I think it was the Healthcare Association that made sure that this information was shared with the regional office. Cause we were calling our survey bureau chief, like, do we have to let this person in? Yes, you have to let this person in. So it's very frustrating. And we did our fire extinguisher trainings in that last half. Let me just outline, because this is newer for you. Anytime Lakewood's had a fire, knock on wood, it has been something small and our staff has extinguished it. Because that's happened so many times, like in my 30 years, I can think of about 3 instances where something happened causing a small fire. And the fact that our staff was able to grab the fire extinguisher, address it, all while pulling the fire line. We are always addressing it before the fire people can get here. And then when they do arrive, they assist us with smoke management. I feel that it is so imperative that we continue to train so that the muscle memory is there, because you don't have a moment to think when there's a fire. So I highlight it, it's something we pride ourselves in, and I want to continue that. I think it's so important in a facility that's so far away from resources.
How many fire extinguishers do you have?
Oh, I wish I could tell you off the top of my head, but we probably have like 200. And
That's
every
a
month,
Steve question.
that's a Steve question or an Aaron question. Every month, they have to be inspected, they have to be turned upside down, they have to be checked.
So Steve, these guys does that,
No maintenance department does that.
Oh, yeah.
but I mean,
He does
he
go,
gets the paperwork.
No, I think we just keep it all in maintenance, but that's one of the things that our surveyor, bless you, our surveyors adjudicate us on.
but he does do a training every year.
Yes, he does the training.
So they have like a big fire pit they have like out back or something, and everybody has to learn how to use the fire.
Who doesn't love a fire in the fire pit? There's something primal about bonfires.
So we involved in the joint procurement, with the school district and the city and all that, fire extinguishers. I know that they have, that's the only thing that they have that is district wide, that they actually joint procure.
No,
No,
now that you brought it up, no.
but I used to be a big thing of mine.
Back in the day it was, I remember, because I was on the school board and you were on the council and we came together and we started this pretty much.
And the only thing that they were ever able to accomplish was to.
Toilet paper.
No, they didn't even.
No?
No, they argued about that. They did.
School probably wanted two ply to count.
Yeah.
It's funny you mentioned fire extinguishers. Let me just diverge to, you heard us talk about level 2, or the second step of the managed care organizations that was put into House Bill 2. What is managed care for us Medicaid is our non-emergent medical transport. And back when we had only 2 companies, each one having a contract, because we have to contract with them directly, including our own transportation company. Each company required a certain height level of lettering for certain things in the vehicle. It's non-smoking, you must wear a seatbelt, like those types of things. But the height was prescribed of the lettering, as was the size of the fire extinguisher. So it was very difficult to know which way to go, because one company prescribed this size and the other company prescribed this size. So a few years ago, when we got in touch with Henry Littman, because they were about to go out for the MCOs to re-up their contracts on becoming providers within the state, we actually went from 2 to 3 different companies. One company chose one transportation piece, and the other one still had the other. But we at least said to Henry Littman, you've got to make sure that they have one style. Like, you can't make us to have to do all of these different rules and regulations when CMS has the expectation, and it's the interpretation of these managed care organizations that then make us to have all these different approaches.
I mean, they had different ways they wanted the fire extinguisher put in the vehicle. They had different signage they wanted up. And it's like, no, I'm not gonna bounce over here for one company and then bounce over here for another and be out of compliance over here. It just made no sense. So we had very intense. Actually, they had the presidents of the companies on the call. And Jack just railed against them. I think he said at one point fraud and something else in there, but at the end of the day, they heard us and they made changes. And we moved forward.
They standardized.
They started, so now there's one
Yeah.
form for accident reporting and then one basic rule that all of our vehicles have to adhere to. I mean, there's hundreds of rules, but it's the same hundreds of rules. But this is one more reason why we just thought it will continue to fight against the thought of managed Medicaid in the state of New Hampshire can go to step 2, which would include nursing home, long-term care and support services, nursing homes, assisted living, and people in the community who receive Medicaid as their support. Are there any other areas? I feel like I'm going through this so slowly. What if I ask you if you have questions? 'Cause I know this is not the most exciting one.
No, I find it interesting, I mean, stuff I'm not aware of, most of it, but.
Sometimes I find things I'm not aware of either.
I do have a question. Remember before I was a commissioner, a nurse came forward who was going to be terminated because she couldn't do her job because of work, unrelated work injury that she couldn't recover from. What was the outcome of that? Remember, she came and
Yeah.
talked to us, what was the outcome?
The only thing I heard was that the commission upheld the decision
Correct.
Right,
to do the termination.
so she didn't move forward with any next steps.
I am not.
I think the only thing that I can remember, and I can look into it, but
No, I was
no,
just
but
curious.
no, I think there was an opportunity to take a look if she wanted
If you wanted another position at DOC.
DOC.
But it turned out that they couldn't use her either.
Cause she didn't have the
Right,
ability
right,
because of her problem, right?
Right. At the end of the day, it is
At
what
At the
it
end of
is.
the day, it was the end of
Moved
the
on.
road.
Right,
Yeah,
Okay.
that was it.
I mean, I haven't heard from the EEOC, that would still be an avenue available to her, and I don't know the statute of limitations.
Well, that's been long enough to recall. Yeah.
So I
So that
have
would be
not
what,
honestly.
November?
I was before November.
Was it?
It was before November. Yeah, so I was just curious, cause she was wearing the summer outfit.
Ah,
I
I didn't even remember that. Good point.
can tell you in a minute, I have a bizarre memory. But yeah, so.
So the staff turnover is pretty much normal for me.
Yes,
Fast and-
you know, what's interesting is I can look for staff turnover and compare it to the local statistics. And even though it seems high, we are really low on our staff
Hmm.
turnover, whether it be specific to LNAs comparing to LNAs, nurse comparing to nurses. But what I find really interesting in the metric is when we look at staff turnover as it has to get reported through this thing called PBJ, which is a national reporting. The Cheryl's team, I know, Cheryl's team has to do that, PBJ reporting, they enter all of the hours in. It shows a lot of turnover for Maplewood because of our traveling staff. So when they come, they can work for say like 11 months, but then they need to leave for at least a month. So even those show as turnover. And what's interesting is our statistics, despite the fact that we have a high level of traveling team members, combined with our own internal turnover, is still much lower as compared to all the rest of the nursing homes in our state. So turnover is difficult and we hate to lose anybody. And our turnover continues to be
Well,
lower.
considering the number of employees we have, 30,
our biggest,
34, 36 is nothing.
yeah, it seems to me that our biggest issue is retirement.
Yeah, they're getting older.
Yeah, we're
Yes,
starting
we
to
are.
see retirements more frequently. There'd be years we would, see retirement now, probably at least 1 or 2 every
Right,
6 months or so now.
yeah.
And I can see a lot more that are within this age group that are getting ready. Any other questions about my report? This was the format I've been using for a number of years. Are there
So you're gonna talk about,
other areas you want me to?
you're gonna be talking about, putting.
Cheryl,
About what?
you said pricing?
Yeah,
Yeah.
was it, you know, it's the revenue
prices.
census goals and things like that here, we're gonna be talking about. What is it called?
Our private payment.
Yeah, president.
Well, and we've set our goal to get to 114, and in the last 2 days, we have moved folks to our third floor to get it to 14, because the referrals that we're getting are more in line with folks on the second floor or fourth in TLC. So by having the 14 on third floor and trying to keep that as intact as possible, it gives us the flexibility to do admissions on whether the units that have the, well, put the open beds on the units that are most conducive to the referrals that we're getting.
So what we're gonna talk about, does that have anything to do with the private pay goal being higher than? I mean, the actual higher than,
Right, and this was for the last 6 months of last year, but on the whole, when you put it all together, it'll still be under, but that's a consideration we have to talk about is, do we decrease
Yeah.
what we budgeted for private pay in order to try to figure out what's going on with ProShare? Well, headline.
Are we on to that conversation yet, or
not yet, we're still on her report, but,
If I could just show you one more thing. This is a compilation of our staffing with regards to the minimum staffing rule and regulation. So we still have not heard that that rule is being thrown out. And so as far as we know, we still need to proceed and still need to, be able to meet the minimum staffing requirements that have come into effect. So what the white lines are showing over here, these columns, they're showing that we're meeting the rules and regulations under LNAs and under total hours per resident day. So we're able to get enough traveling LNAs in addition to our own to staff to be able to meet the rules and regulations as though they were in place right now. But what these red columns are showing are our RNs. So RN, this first column is the 11 to 7, because we do not have an RN 11 to 7. You'll notice 3 times we had an 11 to 7 RN because we had a call out. So one of our nurses from our nurse management team had to come in and cover. And so for 3 instances, just in this particular month, we actually had an RN in the building 24/7, and we would have met that requirement. The next column is the RN hours per resident day has to equal 0.55. And again, you can see there's only one spot, one day in this reporting period where we would have met the 0.55. So we continue to proceed with trying to get LPNs to be RNs. We've been working with the Visa Solutions. We just had a meeting yesterday. So we continue to proceed with that, because until we know any differently, we have to get more RNs in here to meet those minimum requirements.
And it's interesting because got a call last week from, remember the individual we met in DC from, the young man we met from the Intergovernmental Affairs, for the White House? He called me last week, asked for a favor. So I'm gonna call him back, and that, because you just reminded me, I'm gonna call him back, and so I'm gonna ask him for a favor and to have, first, to give me an update where this rule stands. And what would be next steps, because if it's not on their radar with everything else they're doing right now, and it's got lost in the shuffle, I wanna make sure they put it back on the forefront of, we don't agree with the rule, we haven't from day one. Our federal delegation hasn't agreed with it from day one and pushed back against it, so, you know, it's just putting a hardship on the work we already do, and again, we have the highest level, some of the highest level of care, so we're doing something right here within the framework, and so we're being penalized again for a global decision that, shouldn't affect us. So I'll do that today.
So those were the major areas I wanted to highlight. If there are different areas you want me to furnish my report, please let me know.
You have a lot of that.
I do, and I was hoping that that last page would be helpful, so I can keep my report to 3 pages, so that way I don't have to write everything out.
That was excellent.
Yeah, I was just reading HB2, and they have the same type of stuff, but they have less than you did. In the budget up in that state house, so. Okay, thank you. Moving on, and before you leave,
Well, no, we've got this, the rate,
yeah,
so.
Yeah. So next on the agenda item would be master agenda item 1253, private room rate adjustments. Cheryl and Catherine are both here as expected to discuss and vote on the adjusted private room rate for Maplewood Nursing Home. As you remember, we had talked about ProShare, the new formula, and that we were going to have a meeting with Henry Lippman pertaining to where we stood and what this meant with this new formula. And I'm gonna let Cheryl really start talking about it. It was I guess it was a all right conversation, but we don't know what we don't know. We've asked some questions, more questions that we're waiting to hear from. But the truth of all of this will be that we won't know until late May, early June at the latest, what this new formula means to us in reference to ProShare coming back. And we seem to be right at the threshold of the cutoff, but we don't know what that cutoff really means. And so 60%, we're at, like, depending on who you talk to, either 58, 60, or 61%. And so depending on how you do the formula, and that's what we're trying to get a better understanding of what they're saying, because they're saying we're underneath, which is good. But I'll let Cheryl take over from here.
So good morning, everyone. So I'm gonna try to make this as least complicated as possible. I know over the past couple of weeks, Chris has mentioned that there has been a formula change, and that what we have learned in the past month is that in order for a county to be eligible for ProShare under the current formula that compares incoming receipts, meaning all the money from Medicaid, which is our daily reimbursement that we get for billing for our residents, our MQIP money, which is our bed tax that we get, and the one-time payment that we may get from the leftover account balance, if there's a leftover account balance at the state level annually. Those monies in comparison to our costs, which is presented at the cost report level that I do annually, is the delta between what we then can draw down from ProShare. So for instance, in 2023, when we received or 2024, using our 2023 cost report, the delta between our overall costs at the nursing home, or allowable costs, I should say, and the money that we received from Medicaid funding was a gap of about $10 million. From that $10 million, they simply divide it by 2, and that's what we get back in ProShare funds. So that's why we received 5.2 million last year, because the delta between our costs and the receipts that we received from Medicaid was a little over $10 million. So we got back half of that. What the state has just recently learned from doing a similar drawdown for a hospital provider, it's not even a nursing home provider, is that CMS states in their rules that to be eligible for ProShare in that manner, to draw down the difference between your costs. Hold on for just a minute, I'm just gonna shut my door.
But just right in the middle of
Sorry, commercial.
Yeah, I know.
Yeah.
And now,
To be able to draw down in that manner the difference between your cost and your receipts. Your customary charge, which is essentially our private pay rate that we bill to our private pay residents, which is currently $436 a day, has to be lower than 60% of, or 60% or lower than your daily cost as determined by your cost report. Are you following me so far? Our issue is if you take our costs, and I'm looking, I'm looking at our 2024 cost report, because that's what they're gonna base it off of. I'm coming up with an allowable cost on our cost report of 19 million. I'm just gonna round it at 19 million. If you divide that 19 million by our Medicaid census, that comes up with a daily rate of $659.51. If you then take $659.51 and multiply it times 60%, that would mean that our daily
I've been,
customary charge that we pay our bill our private pay residents would have to be under $395 a day to meet that 60%, being under 60%. And so even though our nursing home has an incredible loss, I mean, we only get what doesn't make sense is we only get our customary charge from about 20 residents. And that, but it's still, it's written in the Medicaid plan that it has to be 60% or less. And the state is just learning that. What I have been doing is it's not just as simple as saying what our rate is today. They have to look back at the fiscal year starting July 1, 2024, and then they do estimates right up till June 30th, 2025. And they look at quarter by quarter by quarter of the paid days to come up with what they calculate our daily rate to be. There is a difference between what we bill for our Medicaid days in the fact that there's so many Medicaid pending residents versus what Medicaid has paid us. So there's a potential, if the paid days from this period of time is lower, that could drive our 60% rate up. But we don't know that level of information, and I'm working with Susan Ryan and Christy Roy at the state of New Hampshire to get more information, because we're like teetering right on this, like maybe 62%, 61%, which actually in turn, if it turns out we are above this 60%, what they're going to do to pay us our pro share is they're going to pay us the difference between our daily customary charge and our receipts. So as I've mentioned to you, our current customary charge is $436 per day. So the difference between the 436 and our receipts at a 50%, then getting 50% from ProShare, is much smaller of an amount in comparison to getting $659.51 per day of our costs versus our receipts. So it does not appear that it's gonna put us out of the ability to get pro share, but our pro share could go from over $5 million down to probably just over $2 million because of them having to compare our daily customary charge versus the costs from our cost report. So so where we are at this moment is we are trying to figure out if there is anything we can do to potentially salvage this formula by making a rate reduction to our private pay rate effective May 1st, 2025, which would only be May and June for the picture that the state has to do, to have any positive effect to possibly get us under that 60%. And the reason why, because I have not heard back from the state, that I'd be hesitant to immediately make the change is because if all of a sudden today you make the decision, okay, let's go to $395 to get us under the 60%. If doing that for 2 months doesn't do anything for what we've been charging for the last 10 months, that's going to put us in an even worse position
It's a double lose.
compare our $395 customary charge to our receipts versus $436.
So when you say, Cheryl, just a quick question, when you say that if we bring this down to this 395 and it doesn't do anything, it's because it has to be more drastic to bring it down, or it just doesn't matter at this point, it's too late?
Well, when I sat there and said, if I really wanted to, if in fact they take an average of the last 12 months, and that's questionable if that's what they do. Yeah, we would have to probably bring our private pay rate down to like $300 a day for the next
So what is
6
it?
months.
What would it be, what is it? How many people we have right now paying privately?
20. Well, 21, including the TLC person.
And what is that revenue in a
Um,
month?
6 times, about $270,000.
In a month?
Yeah. And I mean,
And-
if I just simply did the 436 minus 395, so 41 times 20 times 365, a $41 a day decrease, if that would do what we needed it to do, that would be $299,000 in an annual of reduced revenue from our private pay people. And honestly, I feel like that is something we should do if in fact we can find by going to 395 over the next 2 months would still allow us to get the pro share in the formula that compares our cost report expenses. But if they can't tell me that doing this for 2 months is going to help, and then they are going to then base our pro share off of our customary charge and the delta between our customary charge and our receipts, they're going to now pay us the difference between $395 a day and the receipts versus $436. Not that that's huge, but it's like they just learned this. The state, this has been landed on all the nursing homes. There are some that are in the similar boat as us. There's others that are under the 60%, so they're not going to be impacted.
We're right at that cusp. I've heard, like I said, 58, I've heard 61. So we're just trying to figure this out. We don't have all the answers yet. We've asked multiple questions. I will tell you, a county like Sullivan, that on their book, I think they were in the 80 to 85 range.
Yeah.
They're gonna be in problem, there's real problems there. So we don't know also if being over by 1% is a percentage of loss, or if it's a whole loss like she's talking about.
Right.
And then
So-
further, Susan Ryan, who we talked to last week, seems to think that her preliminary calculations for us is that we're just under 60%. So that's where we're urging them to really concentrate. Their formula that I don't know is how many paid days have we had from our Medicaid. And so I'm trying to get all the variables from them so that I can then divide those variables that I'm not aware of into what they should be taking for our cost for 2024. So I've sent a pretty detailed email to them asking for more information. But I'll stop talking and allow for questions to be asked now.
I have a couple of questions. If we are under the 60%, our pro shares formula stays the same?
Yes.
And if we're over the 60% and we reduce the daily rate, not only are we losing revenue, but we also run the chance of also having our pro share amount reduced. So that is 2 losses of income.
That's what we're
And
trying to
then,
figure out.
and so, and now, when do they reevaluate? Is this like going forward forever? Or is it every month or every quarter or every year? They're gonna look at us and give us a chance to replace that amount because we've made adjustments along the way.
That's a great question. And I think where this would poise us is that if there's nothing we can do for 2024, because we're already over, I think we want to poise ourselves to make a rate reduction as of July 1, 2025, so that we get the full year benefit of a rate that we know is going to put us in a position to stay under 60%.
Okay.
And also, because you know me, I like to think out loud and then you tell me that's crazy. What if we did a holiday, a month holiday of charge? Just 1 month and that, because that would clearly bring it down, but.
Well, how much information do we need to know whether or not we're gonna get that double loss?
Yeah,
How much information?
Well, I mean, what are the unknowns? Is it a sure thing that if we go to the 395 for the 2 months that we're gonna lose both?
we're not gonna know until May or June, really, what
Okay,
this
so
looks
there's
like.
nothing that we can know, I mean, nothing that we can find out today.
I think
that's gonna make us-
what's coming out of this today is that we're making you more aware of the situation, and we want the ability, if we need to be able to react quickly once we find the information out and then report back to you. But we want to tell you that this is where we would go at this point, if that's what made the most sense, is what I think Cheryl's saying.
And I don't think you're necessarily crazy, Chris. That's actually a very interesting concept but I think that's something that I mean, because would that like so totally put us under the average? But I don't know. I mean, I think these are questions.
Rule on that. Can I just say there's a rule? You can't not charge,
Oh.
because then CMS, so.
So she just laughed.
Bad idea, wrong playbook.
You were really close there.
$1.
And you probably we can't charge less than Medicaid either as well. So that doesn't work, but.
Carol, it begs the other question, do we go to a crazy high number so that our usual and customary rate isn't 436, but it's above what our charge is? It's like, I'm gonna make it up $700 a day. So that way, if we get stung with this 60% delta and we lose the 3 million, wouldn't it be better to have a higher private pay rate of 700?
Absolutely, absolutely. I mean, if we went in just the reverse, but are you just talking about a one-time crazy number? Are you talking about, but you're absolutely correct, because what one is David Ross from? Merrimack?
Hillsborough.
Hillsborough? One of them
He's
is,
going up, he's doing that, he's going above the number because he's at 95.
At what point?
yeah, but Hillsborough, but
What
they
point
still
do
have a
you-
crazy low cost. So that's, so let's see, so Hillsborough, where's Hillsborough? Sullivan, no.
So right now, there's no decision to be made because we don't have enough information.
No,
We're just rolling around the various possibilities so that when we get the information, we then have had this discussion and then can have the next discussion on what's the best thing to do.
yes, no, I mean, it was pretty much, we thought we had the answer, but as we talked, I mean, this has been like an ongoing conversation. And we thought we had an answer, and then literally last night around, what, 5 o'clock, 5:30, we were like, we're not ready, we're not ready, so we're gonna tell you that we want to have the ability, if necessary, if we all of a sudden learn that we can, this would be to make the most sense, that we move quickly and report out to you that this is where we would go, so that you're comfortable with that, but we just don't know the answers, and we've been asking the answers, we've had the conversations, but nobody's really clear on this yet either, so who knows? The other thing is, I've asked them to ask CMS, and they actually had said they hadn't thought of it, and they said, they said that they were, that they would push this as rural and super rural. Because if you look at Hillsborough, they have a pool of hiring, they can keep their rates, their overall wages can be less than ours because their pool is greater, because they have a, bigger opportunity. We don't, so we have to be aggressive. So, because we're a rural area, and so they are gonna ask the question if there is waivers or some type of math that adds in rural and super rural. And I think we're rural, I don't think we're super rural, I think Coas County would be super rural, but we'll see.
Yeah, because Merrimack, I mean, their bed days is 65,000 versus our like 27,000. And their costs, their cost per day is $378. So that's why they can charge a private pay rate at almost 100% of their costs. Our cost is $659. So to go from a private pay charge of about $436 and now start charging our private pay people $660 a day to stay at 100%, because as Catherine said, if we had a customary charge that at least got us to almost 100% of what our costs are, then they're still going to compare in the same manner. But I mean, unless, that's another question. What if we did it once and then gave them a discount for the rest of the year? I'm just coming. I guess another thought is if we did a one-time increase at the point that the state has to look at this. And yes, I'm sure we're gonna have to have conversations, but I just, it's, I guess, really thinking outside the box and having given all of you an opportunity to wrap your head around hearing the predicament that we're in, so that, as Chris mentioned, if we have to pull the trigger fast, this part of the discussion's done.
Can I just add one more caveat that's a problem?
There's one.
There's one. The federal reg requires that I give 60 days notice.
Oh, right.
So,
Yeah.
being prepared today to talk to you about was presumably rate changes are always increases, and 60-day notices in light of the fact that people need to prepare for that. I was gonna suggest, if you came with a number today, that I give a shorter notice. I was gonna suggest that, we traditionally give a 60-day notice when charging our usual customer daily rate. However, we want to pass along this rate reduction in your next invoice. If we did a rate reduction, and we would have made it May 1st, and we wouldn't have the 60 days. But I would think a reasonably thoughtful person would say, I'm happy to get a shorter notice on a rate reduction.
So does the 60-day pertain to reductions and increases?
It
It
doesn't
says
say
rate change.
rate change, it doesn't say one or the other, it says rate change. But the bottom line is that is driven. It's a policy in place. It's a policy that was probably driven by complaints. So it's complaint driven. And I have a hard time believing anyone in this world is going to complain that we're decreasing their overall cost.
No, but
$50
are we
a day,
at some
yeah.
point going to increase it again?
But then we would do the 60-day if we were going to do
Okay,
that.
I'm just looking at the optics. You gave me a holiday, right, a bank holiday. And you gave me a 20% discount for the month of May, but now in June, I'm going back to my original cost. What is that? What does that say about administration?
Well, I think it's twofold. One is the formula's changing, we don't have control of that. And that's a story to be told. They may not understand it, but the bottom line, it's out of our control. And second is, as Cheryl said, we're trying to get to a point where we get to a rate that's gonna keep us where we need to be.
Oh,
So-
internally, I totally understand.
But
I'm just looking at
moving forward, I don't
externally.
see us, at least in the near future, I don't see us jumping up.
I see, yeah, I see a couple things. Is either, is there something we could do to toy with the rate on a temporary basis to get us past 2020, this 2025 calculation? But if there is or isn't, knowing what this formula is, I think we need to get ourselves poised in a position that from July 1, 2025, our rate has set us up to be very clear under the 60%, because we can only go in two different directions, get ourselves at 60% or lower, or get as close to 100% as possible. And I don't see our ability to start charging for our private pay residents $660 a day. So so like I said, if there's something that the state agrees with that doesn't not meet the requirements on Catherine's 60-day notice, or not charging a resident period, that we could do for a temporary basis to get ourselves in a good position to be under the 60% for this June's calculation of our pro share. That's one thing. If there's not, I still think we need to look at a rate reduction as of July 1, 2025.
So the,
For next year.
so the money that,
Right,
those figures from, that will end on, June 31st
Mhm,
will determine what we get, our next pro share payment will be.
mhm.
And then going forward, we're talking about 26.
mhm.
Yes, yep,
So,
Yeah.
so the change in this 2 months, whether we can do it or not, really, I don't know if we can make much effect on that.
and that's where we're also feeling as well, but we are looking at every angle to see if there's
I think it
anything.
would be better if we go forward when we have more solid.
Well, that's
numbers.
why we, like, we thought we had, as of Tuesday at one point, we thought we were starting to, or Monday, I would say, we had a plan of going forward and reducing, but then we thought about it, we just need more information. And they don't have it, but some of the questions that we've asked, they will have that information.
So let me ask this. Skipping this year and going straight to next year.
Yeah,
If we do this reduction, we're guaranteed to have a win, or we're hoping we're gonna have a win with the new formula where we come in under the 60%.
well,
I know.
I think what we're looking at is that we would be underneath the 60%.
Right, for next
If we-
year.
if we know the
Next
numbers,
year,
yeah.
Unless the formula changes again.
Right,
Unless the administration decides to do something different or just pretty much cancels it 100%.
but there's no, it's more likely the formula is gonna stay where we need to be below the 60%. That's
Yeah.
what, there's no way they're gonna like raise that on us.
Yeah,
The WIT may go down, so our best chance is to try and get under the 60% for 2026. And since we only have a couple of months left for 2025 anyway.
Yeah.
Whatever we're gonna do isn't gonna really save us that much unless we're at 60% or 61% and can drop it down for the next 3 months, period.
correct.
So there's two separate solutions.
Correct.
One is for right now. And is that rate drop gonna help us right now?
Right,
Okay,
We don't
and
know.
then,
But we don't have those numbers, we don't know.
no, but these are questions that I'm asking so
That
that
would be-
I'm sure. So that I'm sure I understand, separating out the 2 years because they're two different solutions. One is for right now.
yeah.
Is anything we're gonna do help us? We don't know. We're hoping it does.
Mhm.
And we're hoping that this change that we put in place for 26, that they don't change the formula and that 60% keeps us safe for next year.
Well, and the other thing is right now they're telling us when they've done their initial numbers that we're under the 60%. So if their numbers are right, because Cheryl hasn't been able to crack their code yet. If their number's right, would it be more beneficial for us to bump these numbers down the last few months to ensure that we're underneath those numbers? That's what we're trying to figure out on
Right.
this side, but next year, yes, next year's a definite, we've got to do a decrease for next year, that's done.
But
It's
next
this year we're
year-
trying to figure out.
But next year also means the state fiscal year that starts July 1, 2025.
Right.
So, but that, we've got some time to deal with, but yeah, I'm. At this point, yes, we don't have all the answers to be able to solidly say to you, let's go ahead and offer a rate decrease so that but we're hoping within the next week or so that we have more answers that would allow us to either say, yes, let's pull the trigger and offer up a May 1st rate decrease, or no, or no, hopefully that the state has done a preliminary calculation and they feel very confident we're under 60%. That would be the best news. We needed to have this conversation so you understood what was going on. We're just not ready at this point to say, let's do one thing or another with our rate as it stands today.
Is it
Just know that.
all or nothing? Sorry, is it if you finish at 61%, you lose it all, or is there a formula ratio?
There's a formula ratio that's gonna now look at our customary charge, which is $4.36 a day. So it's gonna give us the difference between our $4.36 and the receipts versus $6.59 in our receipts.
Okay,
Maybe would we be okay, we'll just take it all out of DOC.
yeah,
So we're basically losing $223 a day times, let's just say 27,000 bed days, or we're losing about $3 million. Because if I just do our 27,000 bed days times the decrease, that's 6,021,000, and
that's
that's
an
50%.
annual figure though.
Yeah, but what I'm trying to say is, no, it's our pro share calculation. The 6,021,000 is what we are losing the ability to capture 50% of.
Okay. If I was state, I'd have frozen your numbers already to avoid any of the counties from changing rates or something to try to, fix the books. That's if I was a state.
Oh, the state,
No,
the
no,
state doesn't mind. They're our partner in this whole
The state's as
transaction.
worried as we are.
Right, because
It's
that's
the federal
federal,
money.
it's federal money.
Right,
And
but I
that's
mean,
coming to the state.
no, I understand it's federal money, but as far as the calculations for the counties, I'd freeze the books right now.
But you can't, because the federal government is gonna look through the end of June at what our costs were.
I understand, but I'm saying I would ignore the last 2 months so that I
The
get a
state-
true picture of what it was, but it's irrelevant because I'm not doing the books.
Well, the state can do whatever they want, but that wouldn't give a true figure because the government, the federal is gonna look at that cost.
So if you get
Yeah,
more,
but
if you get more information that will allow us to, know for sure whether or not we're gonna be able to affect, 2025. Then, if we need an emergency meeting or something like that, we can do that.
Yeah.
Otherwise,
Can we do a Zoom on that?
this is sort of informational.
Yeah.
Yeah, it's important for information you guys to keep aware of. And out of this conversation, we also talked about, we brought up the rural in the super rural, but we also brought up the whole idea of the increase in the funding was because former commissioner, then deputy commissioner at the time, Jeff Myers, was able to open up a loophole that allowed more funding to come in that was rightly ours. It's our money, but it was being held at the government level. And that was for the integrated delivery network, the IDNs. And that was a grant, and that grant was for 4 years and $150 million, and it's 9 regions, and working with health issues on for women, for elder, for children, for substance abuse, you name it. And I said, we took that, we ran with that, we did the handyman program, we've done an EMS program, da 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 da. And he did acknowledge that we're the only county did, well, he said maybe Stratford a little bit. But that really took that and ran with that. And I said, now and we utilize those monies for those projects. And it also been involved into this whole managed care conversation, which looks like it will be in House Bill 2 or HB 2, but as a study committee to take a look at it again, after we looked at it for 2 years, 5 years ago, 4 years ago. And it really comes down to one person who's an executive counselor, who was commissioner at the time, that really wanted to push us through, and now he's on the executive committee, he's pushing it, trying to push it from that point of view. And it makes no sense whatsoever, I don't care. No one can convince me that somebody coming in and now being in conflict with CMS and the Department of Health and Human Services at the state level and the national level, and then adding this private person that's probably not going to be anybody that has any level of health background or degree, but is somebody making those decisions, and taking 10% off of what we're already losing makes no sense to me. But we'll have that study committee. We will sit on that committee. We may ask some of you to, last time we brought, if the meeting was in Concord, we were bringing commissioners to those meetings because we wanted to push back against the system as best we could. So I know Catherine was there last time, and we fought hard to say, we can do this, we don't need anybody else. It ruined mental health when they brought managed care in. So our concern is the same thing. So.
Can I just bring one last
Yeah.
thought, which is, because I've got the 60-day rule, what would you think of me sending a blank letter with no information other than to say, we're giving you notice, we anticipate an upcoming rate change. We will give you the details when we have them. I don't know if that would,
That probably, that's not gonna. It's not
it's
gonna
gonna
pass
cause a lot
muster.
of questions,
Yeah.
but theoretically, because it says a rate change, we might be able to defend the 60-day rate change with a blank letter.
I still say that we're gonna, within the next, I believe we'll have somewhat of a better understanding. That if we're going to do anything, it will be within the next few days, and if not, then we won't be able to make really any decision until, I don't wanna do, I just have a hard time believing that if we reduce it, people are gonna have an issue, and that they're gonna fine us because we only did a 30-day notice on a reduction of cost. I think the policy was put in place because people were getting jacked up and not being told about it.
Yes, rate
And
increase.
they said, we need to do something so people have the ability to have time. But taking it down, I think people wanna pay it tomorrow.
Fred, I agree, but if we do the rate increase, if we decided to go with the other end of the spectrum,
Oh, yeah.
we need to do it by May 1st. For the 60-day to be in effect July 1st, to impact our 2026.
We'd have to have legal to decide, determine whether or not leaving out the amount satisfies the rule.
So just was one other thought,
Yeah.
just to
It
try to
might
get us on
satisfy
the
the
60
rule, but
I'm
Yeah.
not personally worried about the 60-day notice when it comes to the reduction.
Yeah.
Jokingly, I thought we could put in a letter, feel free to continue to pay at this level, but we will only bill you at this level. And therefore, we've given you 60-day notice. So, I think there's any number of ways to play the game, but if we are looking at a rate increase, I would say we need to get that out in the mail by May 1st.
So,
Well, so
But we
we have
don't
a
know.
We have
I
a
don't know.
couple of more weeks before that letter has to hit the
Yeah.
mail.
Yeah. So we're doing our due diligence, and it's repetitive conversation, but it's an important conversation because it could be a huge factor to how we move forward. So, all right, Cheryl, is that good on your end?
Yeah,
that?
that's good on my end. Yep. Obviously, it's gonna be a,
Thank you.
Always excited.
Thank you. Next up is master agenda item number 1254, education reimbursement rate adjustment. Cheryl Tron, please to speak. Action expected to discuss and vote on the adjusted rate for education reimbursement for Cheshire County employees. So she can talk to you about it. It should take just a second or two in theory.
so the current
Cheryl?
policy countywide, that, Kim May, handles the policy, but it's an approved policy, allows for tuition reimbursement up to $2,700 a year for county employees that are going, on to higher education. And the current union contract that we approved for EMS, we negotiated an increase to $3,000. And I would like to recommend that the commissioners approve that the entire county policy goes from 27 to 3,000 for all county employees and not just the EMS contract. It's not everybody uses it, the funds, so it's not as if this extra $300 countywide is going to break the bank.
Second.
Okay, so motions been made and seconded to adjust the rate for education reimbursement for Cheshire County employees from $2,000 to $3,000. Commissioner.
2,700.
700.
What did I say?
2,000.
Oh, and I have 27 written down. I
That's
just
all
looked
right.
at it. So Commissioner Clark,
Yes.
Commissioner Stewart,
Yes.
and Commissioner DiBernardo.
Yes.
All right, we move forward. Next up. Let's start with, I already discussed the Department of Health and Human Services conversation, and it was Henry Lippman he fights hard for us every single day. He is the Deputy Commissioner of Department of Health and Human Services. He is a former Laconia city councilor. So he understands how state can have an effect and feds can have an effect on government. So he's gonna do what he can. He appreciates what we do down here in Cheshire County, and we'll go from there. Homeland Security, I met with on Monday, Homeland Security Director Buxton. And this is a conversation we've been having for a while that started when we actually started with a simple ask about a brick grant, a grant through FEMA that we wanted to apply for to help with the funding of Southwest Fire Mutual Aid. And out of that came that we realized that we needed to do certain things through Homeland Security. We set up a meeting with Director Buxton and have developed this good relationship with him. He was actually the advocate who presented the proposal to Governor Sununu to get the 1.25 million to Southwest Fire Mutual Aid, and that first big gift that we got. And then right after that, we also got the $936,000 through congressional spending request from Senator Shaheen that's waiting for a vote someday. So those two things moving forward were important. And so we wanted to continue our conversation, but we also started talking about and the commissioners at the time felt it was important for us to look into even more so. Currently, the Department of Homeland Security has regional field reps, but they're stationed in Concord. They haven't really, and I got to know them at the annual meeting of Southwest Fire Mutual Aid, and they're really nice people, but they don't know our community as well. And at the time, he was trying to take a look at how we could change that whole perspective and more regional, because what we're finding is those storms, and I've said this many times, that the 100-year storms happening every other Tuesday now, and
When are they gonna recalibrate all
I know,
that, by the way?
I don't know, but I like, not, they're not, because I can say what I say, because it makes sense.
Yeah.
But, and so, and I said, you know, we've got towns that don't have that aren't current with their emergency, plans and they, you know, we don't, and they come down here, what, could we partner with them on some levels? And it's interesting because now he just came, he had, Director Buxton had just come back from, his, national, well, down in DC with, at the meetings that they had down here. And it's interesting because FEMA's going away. It's going to be dropped down to the state levels. And right now FEMA has all the engineers. That's gonna now be shifted down to the state's responsibility to have the engineers within the state. And so he's sitting there, he said, I'm sitting there amongst all these other, you know, and, you know, he said, yeah, Florida, Texas, they may be okay because FEMA gives them so much money. They hire these people because it's so massive. New Hampshire, first and foremost, where do I put them? Simple as that. Where do I put them? So he said, I need you to start at the end and work backwards and tell me how this is gonna work. And so, so it's looking like, you know, those are the type of things, a lot of the grants that have staff there for Homeland Security, like this weekend, he said, we were booked. This place was, we had people coming in overnight because of the ice storms. He said, you guys over in the southwest corner may not have seen it as bad as some of the other parts of the state did, especially up north. And, you know, I didn't really see it until I drove out of, Keene and went to Concord and saw the ice all over the trees and was like, oh my God, it's a whole different world and trees down and all that. And he's like, yeah, we were busy this weekend. We're busy every weekend now. And shortly, it was interesting because shortly thereafter, the governor, I think she thinks I'm stalking her now. But she was talking, she did a press conference in the room right next to where we were meeting. So we actually watched it for a while. And but, you know, he said, you know, we're trying to figure this all out too, because it's all coming down quickly and the budget's almost done. And I may be having to let staff go. And so we've been talking for a while. Why couldn't we put somebody in this county that's a partnership with the state?
Will they pay, officemen?
Well, yeah, I mean, that would be part of the overall cost that we would, you know, would be a partnership type thing. And then that person would be in this county. It would be a person from this county in this county. So I said, yeah, but I need a bigger vision of it. So they're gonna work on what that would look like. And then I said, I need to bring it to the commissioners. And so that they could really take a look at it. But, you know, in my mind, the world is changing and we need to meet that change. And this isn't gonna go away and we need to come up with the plans around this. I mean, what scares me is that FEMA's direction right now is that they're gonna become the American Red Cross. They're going to come in when you have a crisis, make sure you have food, make sure you have some level of shelter, but there's not gonna be any funding. There's not gonna be any funding for anything behind it.
Mhm.
And it's gonna be a disaster.
Mhm.
And
Well, wait a minute, they said it's gonna be like Red Cross. You recall, they removed the Red Cross office from Keene.
yeah, I know,
Where's the nearest one?
I know.
Yeah, well,
It's actually, I think
That's not encouraging.
I think it's in Fitchburg, Mass. Or that in Leominster, that area. I think that's the closest one. It's in Massachusetts.
Would be nice to. have
But,
first.
yeah, I mean, he said, we're gonna be hurt by this in a lot of ways. A state like Massachusetts is a completely, crazy. So it's gonna be interesting, but, you know, I think we could be showing the state how to do something and partner with the state on this. I think, it's Kelly, the governor, has been given an idea of what this could be, and she likes the idea. So again, until I see something that's clear and I can explain, I wanna keep you aware because I have all along from when Jack was, you know, really, you know, pushing this back then to where we are today. But it was a good conversation. What he did tell me though is the brick grant is going away. So FEMA has a brick grant that you can apply for. Don't ask me what BRIC stands for. You can probably look it up, but.
Building resilient
Resilience,
infrastructure and
communities, yeah. And also SAFA grant is going away, it's done. Now, in Keene, that's a big issue,
Whoa,
because
Do they know
Keene. No, I
it was
mean,
just in the paper that they're counting on.
yeah, and it may be, it
What
may,
does SAFA stand for?
it's,
Surface,
It's
safer.
something.
it's just a general grant that they use for, public safety in
And so-
general. It's a very
the
broad
city of
group.
Keene is looking to add 16 more firefighters
You
on.
mentioned that.
And,
That's what they were gonna.
and,
fund
and
it
that
with?
they were gonna do, and it's like a 3 or 4 year grant, and
Who's delivering that news?
And that's like a $2.2 million request. So, and all of a sudden it goes away, which at the end of the day, if you're adding 16 and it's a grant, the grant runs out, you're paying for it anyway. So
Right.
it's just that maybe during that time you can do it a little smarter and you can do it during the grant so that the impact isn't as great. But right now, I know they've added 4 currently last week, at a cost of a little over $500,000. So you do the math. And,
I will say, I've watched the city council meeting or city,
yeah,
I think it
yeah,
was the finance
Yeah.
committee meeting the other day, and unfortunately for them, they were talking as if the safer grant was like a shoo-in, like that they
Yeah.
were gonna receive these funds very likely in the next year.
which they may, they're also believing that the raise grant that they applied for the downtown project is something, and I asked him about the raise grant, because I was curious. And he said, no, gone. Everything's gone. It's like, they're just not going to, and he said, it's interesting, he said there was a grant that you were utilizing, it's called an IMBG grant. And he said that they were gonna cancel it, they were freezing this in May 1st, but the portal's already down. And when they froze the grants, and they said when they said they were gonna freeze the grant, they were gonna discontinue the grants on this date. I know from Keene Housing's perspective, that the portal was already shut down that day. So it was like, if you hadn't, and luckily we had already getting the monies out. And then they opened it back up, so who knows what's going on at this point, but he's like, this is one of the hardest, he said, I don't know how, but we're, every day, I'm either with the finance team or I'm with the development team. And we're all together trying to figure this all out and how to move forward. And he said, and I'm one of the smaller budgets in the state of New Hampshire. So it's crazy, but it was a good conversation. He really appreciates the work that we've done over here, and we're gonna continue to do what we can. On a different note, unless you have questions, I did attend along with Skip, the Blue Line appreciation function that they had. It was a great turnout in my mind.
350 people.
Maybe. I'd say it's probably 250, 260. It was a great turnout. It was,
But he was quoting the Senate.
yeah,
They're always saying.
No, there was.
They're always.
it was,
No,
Yeah.
that was pretty good.
yeah.
That young lady from the Sentinel.
Yeah. But we had a good presence there. We, and Jimmy and Jim Capo and Jimmy Tempesta, good guys. They pulled it all together and honored our law enforcement. And, we had representation from, the county attorney's office, from,
I didn't get an invitation.
dispatch, sheriff's office. And I don't know if there was somebody from the Department of Correction there. I thought I saw, one of your guys there. Oh, he's gone. There, but it was, I thought it was good and the food seemed to look good and,
My favorite color, green.
I know. And, you know, the governor was there, got to talk to her for a second, got to talk to some of her people real quickly, which is good. Oh, that's the other thing. So I talked to, Homeland Security Buxton about two opportunities I want to pursue. As you saw the clawbacks happening with the state, with DHHS. Well, I'm really getting nervous that they've taken 2.5, 3 years to try to get this broadband last mile monies out the door, and they still don't have a plan. And so I'm going to reach out to, after talking to him, he agreed with me that this would be a good idea. Reach out to Chase Hagman, who oversees the person that's trying to put this plan together. And Chase has been a very good friend of Cheshire County, and talk to him about, you guys are putting at risk a clawback. And I have a shovel-ready project and I'd like $2 million. And so I'm gonna, you can't help it, you know, I mean, what can happen? They can say no, or we're not ready yet. But they've told me all along they're gonna have money left over, so I'm gonna, and I also got the card for one of the staff members for the governor, because I talked to, it's always good to handshake with the governor. It's more important to talk to the people on the ground that are doing all the work. So I'm gonna follow up with a conversation with him today too, to see if we can set up a time to go up and talk to the governor about that. Also, I talked to him, I said, what is the true meaning behind the charge on your phone, cell phone bill for the 911 monies that they have? If you see, there's a 911, I don't know what it's called, 911 amp charge, something charge. And I can't remember what it is. And I said, what's the true meaning behind it? He said, exactly what you guys are doing. I said, right. And I'm hearing that all the time, this, you know, this money goes here, here, here. And I said, and look at what they're doing up to the lakes region. And he's like, I know. He's like, they're building a whole new building and all that with that money. Part of that money is that. So I said, what do you think? He said, all right. And so he gave me the name, so I'm gonna reach out and see if I can get at least 500,000 from them. So we'll see. And if I'm doing that, I might as well ask for an added 2 million for the capital region and another 500,000 for the capital region too. But I'll say very clear, if it comes down to it, think us first. Cause I'm asking, I'm doing them a favor. So that is gonna be a project I'm gonna be working and pursuing on. So it came out, it worked out well, but again, those opportunities, the reason I go to a lot of these things, is because, yeah, free food. But yeah, I know it is, but the brownies are pretty darn good. And also to just connect with other people to see if there's things we can do. And I will tell you, I came one number away from winning a Glock. And another number, 2 numbers away from winning a shotgun of some sort that they were giving away. So I don't know. Funny. Didn't even come close to what I really wanted, was this, they had this like grill thing that was pretty cool. Stomach first, protection later. So that was that Blue Line thing. I also want you to know that we had our first meeting yesterday with, NACO for the County for Housing Solutions. You know, that Cheshire County, Grafton County and Sullivan County put in a bid to go through this course. That at the end of the day will help us and guide us and give us a better idea on how to move forward with our properties we have here. Doesn't mean we're gonna do it, but you know what, they're bringing housing experts to come in to take a look at. At the end of the day, you know, you have like a capstone project, presentation that you do. We have 749 acres, you know, we're currently, it's a farmland, blah, 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 and this is what we could do. And we talked, I had to say a few words yesterday and just talked about the possibility of workforce housing, or if you know, that we've had opportunities from others in the past to put different projects out here, but that now we're looking internally on what that would mean. Now, a lot of these projects, you've got to remember, if you're outside of New Hampshire or New England, counties are building these projects. They're taking the loans out, they're building these projects, they're overseeing them, they're renting them out. No, ours would be to get to a point where we would have, you know, we'd have a clear understanding of what we would want to do, and then we'd put the bid out to, the RFP would really categorize what we're looking for, whether it's mixed use, whether it's just workforce housing, whatever it may be, if we were to go this route. Again, there's no certainty, but I'd rather have a little better understanding on what we want to do and learn from the individuals that bring in. So that was yesterday. I think it was about an hour and a half that
Yeah.
we did that. Well, the cool thing is, we've also had an opportunity to have a college student who's coming from school, looking for an internship for this summer. And I've presented the idea that he could come on and help us with this project. And the school pays for his internship. And so, my thing would be, then, you know, this is a great experience for him to learn about county government, because I'd also, you know, have Suzanne work with him on, you know, learning about grants, and I'd also bring him into some meetings like this or whatever, so he could see county government work. And it'd be a good education for him, so.
A project to look into development of county land,
Mhm.
and I'm opposed to that, first of all, so go ahead, but.
Well, I mean, I just know that I'd rather have a better understanding of what this land could be used for than not. Because you guys ask me this question all the time, and we just had a horse farm that somebody that wanted to buy 25 acres of our land. And we don't really have an understanding of it. Until I do, I can't look to you, you know? If,
Yeah, once you start on that avenue, though, then it sort of becomes a, predictable kind of a, thing that is going to happen.
It grows
Well,
legs, you mean?
Yeah, and I frankly think that you need to develop a philosophy on that first, before you, determine what sort of things you can do.
Yeah.
Is whether or not you should do. Because this is a, you know, this is a 250, 275-year-old thing we have here. And it really should have a lot of thought that goes into the basic philosophy of it. If that determines that, yeah, we can, you know, we'd be better served to do something, then we can take a monumental step. But
If I may, basically, you're just talking a study to see what could be done overall. And it's gonna generate more conversation anyways as to whether something should be or shouldn't be. So why not put it on the table and talk about
Because
it?
I think if you go in there already determining what you're gonna do, then that is the shape that you're gonna follow.
Well, I understand that, but I'm not doing that. I just,
Right,
it's
but
gonna generate more conversation if you say, hey, this could be done or that could be done.
I agree, but I agree, we need to look at what should be done with the property. However, if we go in there with preconceived notions about what it should look like, then that's the road that's the path that gets taken.
No, I understand that argument, but who you conceived so far? You mean just by seeing if housing's available, that in itself is a
Yes,
exception? But no, I understand what you're saying. I,
because once you start looking at it as housing, then it's just what kind of housing. It's not, that nothing else enters the conversation.
no, I understand your point, but I think I disagree in that it just will generate conversation. The moment you mention selling off any of your property, you're gonna have old timers coming back in or.
Yeah, no, how I look at it is that, I mean, it's so, this is just a piece of the puzzle that we could look at, you know, and I doubt that I signed on to educate myself, so I was better understanding of the whole overall process. because I also know that now that Amanda Littleton has moved over to the Monadnock Conservancy, you know, would you ever consider putting any of this under the Conservancy, you know, you could do that. You could, you know, I would love to put, grow hemp out here or we'll have a cannabis center out here that we could generate revenue off of. But, you know, right now what we have is something that we're always going to have to utilize funding for to take care of, over time. So I don't really, I don't.
My basic problem with that whole premise is that there's this conception out there that if you build housing, that it's gonna solve the housing issue,
Mhm.
and it's not. That's not the problem. The problem is much deeper than that. It's the system that we live in, the economic system that we live in. Many people, most people are not prepared to deal with it. So you're just talking about subsidies if you want to build housing. It's not making people afford the housing. It's subsidizing the housing. Now, forget about that. Now, we can go back to the discussion when they were talking about renovating this building or moving it to Keene. That right there centers a lot more about what we're talking about here. It was a philosophical discussion on whether or not we're gonna keep this building here.
Mhm.
And what that all means, as opposed to moving it out of here, then that would have left everything all vacant here. Then there would, then there would really be no need to have all of this land. Whatever, but as long as there is a, philosophy that we should use this land for county uses, then having other discussions, without you sort of just do this. I didn't really expect to have to defend my. I don't know, sometimes where it goes, but, if you wanna have a discussion about, this land, what are they, what do we wanna do with this land?
Yeah,
Then I think I'd be willing to start there
yeah.
as opposed to jumping to a project.
Well, I want to make it clear, I'm not talking about a project. I'm talking about having a better understanding if one category was something that was this. And this, just for the record, this isn't the first time I brought this conversation up. This is because when we were talking about the horse thing, you guys started talking, and then all of a sudden this opportunity came up and they asked if we would join to do that. I said, well, it can't hurt that we're educationally, we're looking at something, so I have a better understanding of what that would mean. But it doesn't mean that I'm in favor of this. I mean, I've gone down this road before because we've had people that have wanted to buy plots of land on the Connecticut River, and I brought that forward and know what that happened when that happened. And when we sold the property down here, the 5 acres, because we owned the house that was falling apart, they finally came around to understanding it was just one plot of land. And that's all we were doing. So I have no issue. I have no agenda. I just wanted to do my due diligence to have a better understanding if that was to go down this road.
What if Terry's overall idea that we're just trying to find out what's the best use or what the community wants to do with it as such? Can't we include the study for the housing as just a part of it, knowing going into it, that's just one part? And knowing that the conservatory people will come forward also, we can talk to them or anyone else. You know, I mean, I'm not in favor necessarily of housing, but I think just
I would rather
education.
I would rather have the first step of do we want to do anything with the land?
All right, and just start it off as a separate conversation
Where are we?
have it
You know.
painted, is that?
Yeah, let's look first, I don't wanna be corny about it, but let's look at the heritage of the whole thing first,
That's part of it, yeah.
all right? And then knowing that, you know, everything evolves,
Mm-hmm.
you know. Where are we in that evolution? We have all this land, is this something that, you know, is a good thing to keep for another 100 years, then something else might come up that is incredibly important or whatever.
No.
Are there forces that, would, not make us, but, turn our heads and say, well, this is a direction that county government should go into or not? I mean, because this is timeless, we're not just talking
No,
about.
I understand that it's a serious project and involves.
You and me will be gone soon.
Oh, yeah. I think we should build a cemetery.
I've got two. I have two.
But I-
Because knowing that, the discussion that they had, it was a philosophical discussion about, whether or not they ought to keep the nursing home here. They'd already moved the jail. The farm had been gone for years.
I haven't paid attention to the conversation that took place. I know that strong on both sides, so.
Yeah, I wasn't there. I would be interested if we had any minutes or that talks about that, conclusions. I don't wanna get into the,
There's a lot of minutes.
maybe
on
Jack
Maplewood.
Pratt's memoirs, man,
I could sum it up.
Yeah.
Do you want at some point suggest or move that we have some kind of a study as to what is the best use of it? Completely independent of
What we'll do first and foremost is there was a farm study done.
Mhm.
We will resurrect that study and take a look at it.
Yeah, I'd be interested in doing that because, on one hand, I believe in the heritage and it should be preserved, but then for what? Right? Maybe there is a direction that we should go into, but we need to make that decision first before we start getting in particulars.
I think one of the things that makes people, in my opinion, a little casual about the farm is that because everything around us is rural, it's just another piece of rural land. And that land feels endless because it's all out there, but it's not. This piece of land does have meaning over a long period of time. And I agree, looking at what is the best thing to do with it and not just assume housing is the right thing to do with it is important to look at. I mean, there are lots of other things that are done with pieces of land that continue to make it accessible to the community. What are those other things? How, versus just housing? Because it's not gonna solve the housing problem. You can put up 50 units there or whatever, and the housing problem is still gonna be the same. So it's not gonna affect that, but I would like to look at when you're doing this program, if you could look at various projects that don't have to do with housing and include that in what you're looking at in terms of what can be done with this piece of property versus just saying, what kind of housing can we put in there? What are the various options that we could look at for housing? But look at when you have this much of a piece of property that's this historic, what other uses did people do with that property? Drumlin Farm down in Lincoln, Mass, it's a Audubon thing. And it's an educational program and school field trips go there and it's a whole outdoor thing that people pay to use. Right? So, I mean, when you look at what can be done with a massive piece of land, the whole farming thing. And so looking at, is there some way that we can find an organization who might want to do something similar to that versus just making it housing? Because that is, a thing that does make money and it fills, an area for the community.
Oh, yeah, no, I mean, we've had individuals, not groups, come forward and say, could we do walking paths that docks,
Kind of recent one.
the boat launches, all that stuff. I mean,
Sure,
West
but
Midlands.
I don't
a whole
wanna see
beach.
something that the county has to now go out and have landscapers and maintenance people cost to that. That's why I'm
Understood.
looking at it as a
It's-
different kind of thing
Right.
versus paths that somebody's gonna have to make sure there's no poison ivy or we get sued kind of stuff.
Yeah, Aaron Newman would not be happy with us.
Right, so I'm not looking at it another cost center for the county to have walking paths. I'm looking at it.
It's
is
why
there
we
some-
shot, it's why I shot it down when.
Right, I'm
Commissioner
looking at
Cartwright
some
brought
sort
it
of
forward.
nature-based classroom learning environment that is its own thing, not
Yeah.
our thing.
Well, we've built one before, at Keene Middle School, when I was chair of the school board, if you go out behind the school. And they have ramps, I mean, wooden walkways out through there because it's a swamp area and so the science classes and anybody actually can go out there, but. It's utilized for every class out there.
Look at that farm, Audubon runs it, so I mean, they may be able to, shepherd this piece of land without it costing us to do something like that.
Well, it's sort of like, a lot like, if you went up to Woodstock, Vermont. And the farm that's up there, but then again, it's the family that put all the money behind it. Starts with an R and ends with a if we could, I mean, if we could.
I'm just saying, include that in the things, options that you're looking at when you
Yeah, yeah.
take this program, that's
Yeah.
all, it's,
Yeah. And again, we only took this because it was free. It was an opportunity to understand it better. There was no agenda like. Derek, I think, has a clear thing that he wants to do in the Unity area around housing. Grafton, I think, is more like us. They don't really have a project. They wanna learn more about it because they just wanna educate themselves, because if it's presented, then they've at least learned what the steps would be to get there. There is no agenda to it, but we can take it. So we'll just move on from there
This
then.
is very rich alluvial land
Mhm.
that once you use it for something else. It's not best suited for, there's no turning back,
Yeah,
Mhm.
and
not a problem. But we're gonna, we'll actually add that into the scope. Moving on, sanctuary counties, I wanna talk about this for a second. Because, in meeting with the, Homeland Security Director, he did say. You should do whatever you can to try to see if you can get off any list that you've been put on. It would be in your best interest, yours in Hillsborough.
Are we on the list?
We're on a list.
Mhm.
Well, we don't know if it's official or not, but.
It doesn't matter,
It doesn't-
rumor has
It doesn't, right, it's and he said, I said it was a, what is it, the, journal?
New Hampshire Journal, and they reference,
Yeah, no, it's New Hampshire Journal. They came out with, is there a sanctuary city? They didn't even define what sanctuary means because there is really no meaning to it.
it was in January.
And so I was interested in reading the article and reading through the article, and then I said, all right, well, who are they? I wonder if Keene's on it. So I start going down and Cheshire County's on it. Why is Cheshire County on it? In 2017, when that whole idea of immigration and holding individuals,
And
came
Eli
out,
said,
Eli, Sheriff Rivera came out and made a statement saying, if we do not, if criminally, they do not have a record or a warrant out, or they haven't been caught in an act that is illegal, I have no ability to hold them, is what he said at the time. That's what they base it on. There was never been a conversation with the commissioners. There's never been a discussion, resolution, or motion of any kind. So I took that, and I know that I talked to Tony Pappas in Hillsborough because they don't know how they got on there either, because there's never been any conversation. And so it's just, but in this day and age, that type of stuff is dangerous. He said it could at some point put your Department of Justice grants at risk, or whatever it may be. So then I went and talked to Chris McLaughlin and said, all right, how do I take? I want to put some weight behind this, and he didn't disagree with my idea, but he said that we should probably go through Primex to see if their lawyers would do it, but I want to send a letter to the publisher of this, that I want them to rescind the article. And have them know that any damages forthcoming will be pursuing legal action against the for something that's fraudulent.
So,
Well, did they just report somebody else's statement about that?
No,
So they
Was it
bounced it.
editorial?
So they bounced it from, according to media reports from 2017. If you click on that, it's an article from the Brattleboro Reformer from
Right.
March of 2017, saying the New Hampshire Sheriff will not assist
Right,
Homeland
but that's
Security.
just a report.
And then it says, with nothing to back it up, that in a press release to the media, Eli Rivera noted the exact things we just discussed, which is not linked here, and
so the issue comes down to not what they reported, but what he said as a representative of the county.
understood.
And so I heard about this long before I ever ran for office. This is a known thing about this area.
Mhm.
Whether or not it's official, it is officially out there that Keene and a lot of areas around are sanctuary cities. So that is something that you can argue with the journal to rescind that, but you really need to address what people see as public and common knowledge about this area and about the sheriff. That's where it has traction. You can say that they should.
What is sanctuary city?
It's
Legal
where you
definition?
don't know. It doesn't matter what the legal definition is. It matters of what the perception is that if there's somebody picked up and they are illegally in this country, that the law enforcement would ignore that fact because there isn't some local jurisdiction thing that they did. That the overall arching crime is to be here illegally. That's the crime that people are focused on, not whether they were speeding, stole the car, did a rape, did whatever. And so for a sheriff to say, I'm going to ignore certain laws,
But he's,
that's the perception.
Yeah.
That, you asked where it came from.
but it's not a law, right?
To,
It's a
Looks like
perception that
trying
it's
to prove
it's a
that I'm not-
perception it's a
and
law.
here's the thing.
It's some made up word.
Wait a minute,
Trying to
is
prove
it
that I'm not wrong.
illegal to
It's a
be in
whole-
this country without authorization?
Well, but it's a hold, right? That's what,
No,
that's. it's a-
first answer that question, because people are looking at, is it legal to be in this country without authorization? Because you're working with people's perceptions.
Right, no, I get all that.
So the question is a yes or no. Is it illegal to be in this country
In
without
that
authorization?
reference, it would be perceived as yes. But
That's
the
what,
question ICE is asking us is hold,
because
Right.
if jurisdictions, say a bank robber
Mhm.
robbed a bank in Keene and fled to Gardner and the police picked him up.
Yeah,
That is a uniform crime. So do they say, well, he didn't do it here or whatever, right? I'm not gonna hold him.
Okay, but the crime you're saying, is it, something that we can just bring them over to over to DOC and throw them in the same cell as somebody who? you know,
Yes, in that example, yes.
Yes, it is.
If they have criminal charges through legal means, the courts and or warrants, we hold them. If they also have an ICE detainer, neither here nor there, we can hold them in the same parts, housing areas of the jail. If we don't have a contract with ICE, though, once their criminal charges are resolved through the courts, we have no authority to hold them beyond the release date established by the court on the criminal matter.
And if you do have a contract with ICE, then how long is the hold until ICE comes and picks him up? And
Well,
then and then they're being paid for by the government for you to hold them.
it would depend on the contract, I suppose, but
Right.
I
You're
think
not
it's,
holding somebody for free.
so I have three questions then, Doug. One, you said if they're just being held, there's no, like they weren't caught breaking and entering, they don't have a warrant for them, but they're here illegally, so they're hold. Can you hold them in the same population?
we're not gonna book them into the jail if all we have is a detainer request from ICE. Because it's not legally binding and there's risk, including some case precedent for the ACLU to sue county jails who have held people on simple detainer requests.
So my next question would follow up to what you just said. Are we liable for action like that, or is ICE, because they're the ones requesting the hold?
They can request it, but we're not gonna book them in. We're liable if we book them in. And there's no criminal charges. A detainer is, right now, it's really just considered a request.
Yeah.
There's nothing binding and it actually contradicts, I believe, criminal code in New Hampshire. And the 10 superintendents have adopted really the same position, which is a little different than what I think Eli said back in 2017. We will give the courtesy of notifying ICE when we know there's a detainer. For someone that we have been holding on criminal charges, we will give them the courtesy of notifying them if they wish to come pick them up and take them elsewhere, say to a facility where they do have a contract.
Is that a policy in effect right now?
Yes.
Mr. Correction, if you pick up someone for some other criminal charge, how do you know whether someone's a natural citizen or not, or illegal citizen? Do you run any kind of a check on that?
We don't, well, I say it's in effect, but we literally haven't had at least in my 5 years, we haven't had a case where we've had somebody with a known detainer. But the answer would be we don't go out of our way to run that or look at their immigration status. But if it is come to our attention and ICE has notified us that they want this person who's held here on criminal charges, we'll work with that. At the point they're released from the criminal charges, we would notify ICE.
Well, I wonder why we don't do it the other way. If you bring someone in and you know that they're illegal, why not, just as when we cooperate with any other enforcement service, why wouldn't we call ICE?
I suppose if we did, we could, but we aren't getting paid to go out of our way to research that, verify that. But if we know that to be true, I
If
suppose.
we're taking money from the feds to hold their detainees or prisoners, I would think that we'd have more cooperation with them.
That's on criminal charges.
I know the difference between the criminal, but if you're working with a law enforcement agency, I would think that you'd go out of your way to help, just like we always say that we have mutual aid. You know, we pride ourselves on how mutual aid is important. I think it would fall under that category. If you have.
They're different federal agencies. But yeah, I don't know. I mean, I guess we can have a discussion about how far we go. And as long as we don't violate the law or put ourselves at risk of a lawsuit, then I'm probably likely to be open to that. Just general communication and cooperation with law enforcement partners, something that we certainly do on many levels, and communicating and cooperating with them is different than, holding somebody.
No, I understand the difference between holding them when their criminal charges have been dealt with, but I would think we should be cooperating more with ICE, and I'd like to have a further discussion on it and see what the legal obligations are.
As would I. And is it just, if we are not being proactive by omission of any action, we are stating that we support a sanctuary city policy.
Well,
Because we're not doing anything to
Enforce the law.
enforce the law. And so if you see a crime and you don't enforce the laws that stand, then what you're saying is it's okay to keep doing that. And so that's the optics that everybody is looking at us with.
but when somebody comes in, when you book somebody, when somebody comes through that door,
Mm-hmm.
they, do they have to give you an address? Do they have to? I mean, how do you, when somebody comes through the door, how do you know who they are?
They don't have to give us an address. Most of them do. Sometimes they go as far as trying to give us an alias, a fake name, and can be wholly uncooperative. And all we have at that point is the law enforcement records or a warrant and whatever information may be on that gives a name. It's quite rare, but there are people that are homeless and are, honestly, they're not just trying to avoid detection, and they are listed in our system as homeless.
And prior to them getting here, does the police that are bringing them here, do they have to, when they come upon this person, they have to do they run some type of criminal check on that person?
Do they run other criminal history background checks and
Is any outstanding warrants against them or anything like that?
From out of state.
in some cases, I think they may, but in most cases, they I think don't at the initial point of arrest.
Yeah, I'm just trying to, because my thing, go ahead.
They may, once they're detained, the prosecutor may, I don't know what Chris's office does. At what level of charges or cases do they look at other running a history and actively looking at other warrants criminally?
Mm-hmm.
I'm not sure the answer. We are notified. It's not that different, by the way. We don't run full criminal history on every person detained here criminally. So the point about us trying to do it on their immigration status, I wouldn't even know how that's done.
So let me ask you this question. You arrest somebody here in New Hampshire, they're charged here in New Hampshire, but you don't run a background check and know they're wanted in 4 other states. You never check with the other states?
We don't.
So what is this process then? Where somebody has a criminal record, an active warrant in other states, we arrest them here, but we have no obligation to find out, should we turn them over to the next state for the other murders they've committed?
I'll double check on which cases at what point we're doing the background checks, because I'm not 100% sure, and I don't want to be wrong about it.
Wouldn't that be up to the police?
It certainly can be, and we're sent warrants from other states. that come to us and then we're made aware of them. And there's extradition requests that come to us from other states. And we, act on those.
So how does that other state know that you're holding that person to even send for extradition?
Probably through the initial arrest and action by law enforcement, but I'll check what we're doing through the spot system when we have bookings and how far reaching that is. And I want to verify that I'm accurate about when we are or aren't doing that.
So I'd like to figure out what we need to do to show that we are being more supportive of other agencies who are in pursuit of criminals. And if they are illegal, that we support whatever agency.
If you see something, say something.
Only certain things can we say something nowadays. I'd like to figure that out.
What was your original question?
I was just saying that we are going to do what we can to try to figure out how to move forward in addressing this situation before it becomes a bigger issue.
Right.
And, yeah,
I believe, as Claudia had said years ago, Keene used to be known as a speed trap. This goes way back, and it's the same deal though, that, what do you mean a speed trap? Oh, they'll stop you for speeding or something. So it had a reputation as a speed trap. And this is basically what you're trying to do away with as far as what Eli had said.
well, the city of Keene did a thing at one point, had a conversation about something, and I think it was, Representative Shapiro that did all are welcome here kind of signs. And all that, so there's a perception, but there is no official, there was never any official that I'm aware of, maybe you would know.
No, there was a mayoral resolution that was, signed, supporting, that Keene is a welcoming committee, welcoming city, whatever the hell that means, but it didn't,
Right. Just general.
Who are you welcoming? That's the thing.
everybody,
Yeah, I think it was.
diversity, we don't care if you're black, white, green.
We love that word diversity.
Well, I think it's, well, anyway, I don't know.
Way overused, in any event.
No, but there was never anything official, as a matter of fact.
Resolution is talking about has been erased from
I
Keith's
can't remember
website.
who was the police.
Yes.
Yeah, I just tried, I found it and I clicked on the link and it's gone.
I thought we were paying 5 chiefs at one time, I City King.
It's right
Yeah,
here.
4 retired and 1.
Welcoming community.
one-
In any case, the question before us is that we want to avoid having federal funds removed from us.
Right.
Just,
For any perceived wrongdoing or, and as far as I'm concerned, we're not doing anything wrong.
Right, but how are you gonna communicate it to?
Well, there's some people you're never gonna change their mind, so no matter what you do. So in my life, I just move on. And
Right, but
people are gonna be people.
Yeah, but constituents do want to know that their concerns are being heard.
no,
And that is, we do have to address the perception that there is this whole welcoming or sanctuary city feeling going on. And things are happening that people don't actually support. And whether or not we're doing it doesn't mean we ignore those questions or concerns. We do have to do something obvious to combat that if we want it to go away or to be diminished at all. So we can't just ignore it.
I disagree, I think that this is a non-issue. So far, there has been no charges that we have done anything wrong. So in the absence of that, you know, I don't respond to gossip and crap like that because it doesn't go anywhere.
No, I understand the gossip, but in as much as we have a legitimate concern as far as funding goes from the current government, I believe that Chris has a fair question as to we should do something.
Mhm.
And I think we should do something. And as far as, it was mentioned legally or whether you need legal advice, but
I'd like to be able to show, if push came to shove, that we went as far as we possibly could to say, this is just not true, it's not an issue. And it's just, you know, perception more than anything else. Whether, there's two issues, like you always say, there's two issues here. One is perception, one is, what do I need to do on a front that was, when somebody's made something in a paper that could then.
If you go after the New Hampshire Journal, you give this more legs than it has currently.
That's the other side of it.
And all it does is me think they'll protest too much. That's what it's gonna come down to. They're denying any wrongdoing and they're shutting down transparency, or they're shutting down the media from speaking the truth. You're gonna give it legs that you don't want it to have.
wait, you lost.
Oh, no, I just
So-
say, no, I say we should just ignore it.
He was saying, writing, getting some
Well,
legal
he's
advice
asking
about
us-
going to the new,
He's
going after.
asking us if we should do that, and I say.
I
no.
think
Do you disagree? I agree that we should do something. You,
I'm agreeing we should do something. His
Oh.
idea originally was, should we talk to the lawyers and see about getting New Hampshire Journal to retract what they said and then say if we have cause to go after them.
Well, and the other portion of that would be, do we bring Hillsborough County in to see what they would want to do too, so that we're doing it together as two counties that don't know where this came from, because we've never taken any motion or any, you know, resolution has been presented at all. We've never had discussion. We've had more discussion about this issue since the article came out than we have prior to that.
I would suggest that whoever at Hillsborough, that you speak with them.
Yeah,
And I would think that some letter would be appropriate, just so that. To the journal to begin with, just so that we are on the record as showing we totally disagree with them.
Cause if it's not, they did say that they reached out for comment to these people, but we are not one that responded. It doesn't say who they reached out to, so at least a clarification could be something that.
Well,
they should
and
do.
just so you know,
They
I
didn't reach out to any
did
of
already
you,
send
yeah.
something to the editor.
Mhm.
Stating that, you know, this was news to the news to the county, because we've never had a motion resolution. And that we're disappointed that this has been, and that's it. Never heard anything back from them. There was never any follow-up article.
People are gonna say what they want about you,
I
and goddamn thing you do about it.
My thing is more about money than it is anything else.
obviously, you're not Italian.
What do you mean, they moved on to another, minority, what are you talking about? Nobody talks about Italians anymore,
So,
right?
Yeah,
They moved on.
excuse me, go ahead.
so
He's
what
talking
I,
about grudges. He's talking about grudges. He's not talking about ignoring shit.
Oh,
About getting even.
yeah,
well, you don't talk about getting even, don't you know that?
I'm half Irish.
No, you don't talk about it.
you just do it.
You just, yeah, you don't talk about it.
Half Irish, Italian Irish, you like the.
So what I'm going to do is I'm gonna reach out to Hillsborough County, my counterpart there, say, is there any level of concern or desire? And if not, then we'll just move forward. And see what happens.
I'd agree with that. You don't need a motion, do you?
No.
I mean, that's part of it.
I'm not doing
Background
anything.
notes.
I'm not doing anything, so.
Okay,
So, all right, see, I've had some good stuff today to really get you guys going. All right, I'm gonna keep on moving on. Just so you know, we had our first meeting with, as a whole body down here with people around visa solutions, and really, from my understanding from Kim, and Kim will report out next week, but she's away today, that it went extremely well. It's really interesting because they really want to know, as they try to match people up, what the culture, the environment is here, so we get people that are like-minded kind of thing, that they try to as best they can. And they really ask some really deep, some good questions about that. Is what the feedback was yesterday. It looks like Sabrina Priest will be heading up the onboarding and really working on this through and getting people here, so that's exciting. So that was the first meeting. They've got another one scheduled, I think, next week, and they'll just, and we're looking at, about 4 months before we possibly could have some people coming here.
Cool.
Yeah,
Uh,
and that's it. Yeah,
if or when you're ready, I will give a more clear answer about what we do to look for warrants in Cheshire County.
fire away, because I'm done, so you might as well add.
All right, the jail does not. We can run criminal histories on people, but that's different. Those are resolved charges and whatnot. The jail doesn't have access, as I wanted to make sure, we don't even have access to the NCIC system. Local law enforcement could run those, and or they're run out of dispatch. And they are, the NCIC system would be checking for active warrants on people at the point they are detained, but the jail's not directly involved in doing that. If there are warrants, there's notifications that happen, and if we're holding someone who is found to have an active warrant criminally, then we would receive it and be made aware of it. Again, that's about criminal charges. I don't know what happens around immigration-related detainers and violations of immigration, and whether that's a different system or if anything's happening routinely at the point of criminal arrest to look at that question. So everything I just told you relates to criminal charges under the RSAs in the state of New Hampshire Criminal Code.
Thank you very much.
Thank you.
Okay.
And so, and I just remembered too, thank you, Doug. I just remembered two quick things. I don't know, did I talk to you last week about our meeting with the city of Keene
Briefly.
About EMS?
about EMS?
Yeah.
Okay, I did, and about the mayor, the lunch with mayor?
The 16th.
Okay, I did talk about that?
Yeah, it's in the minutes.
Okay,
please,
good.
so.
Then I just want to make sure I did. Then I'm gonna move on.
Well, I'm gonna say something right here. Immigration law is primarily considered civil law, meaning that immigration violations are generally handled through administrative proceedings, not criminal court.
In what state? Just is that a federal
I
thing?
don't know, I just, according to Google here,
Oh, Google is.
well, that would be federal,
No, I
immigration is federal,
I appreciate
so it's not, so I mean, this talk about, you're an illegal, so therefore you're a criminal. If you were speeding, are you a criminal? No, that's a violation, that's not a criminal charge, right? So if we're gonna talk about terms, let's get them correct,
That's fair.
right? So
You're in violation.
if you're in violation,
Yeah.
you're not a criminal. So therefore, that falls under a whole different rules.
No, I understand your point. I don't totally agree, especially with Google, but I understand the point, yeah.
It's my personal Google that gives me the answers that I.
Conservative,
Yeah.
Good.
All right,
I appreciate that.
okay, all right.
We'll take.
No, but I mean, as far as liability goes, that's a big deal.
That's why I say we have liability. We are holding people and we have authority by state statute to hold people on the criminal code in our jails. That's where that liability that I spoke about comes in. And I didn't think to use the term civil, but I do believe that's the proper distinction there. And so without some other contract that authorizes jails to hold people for that purpose. That's where the risk would come in that I spoke to earlier.
Thank you. So, McLaughlin, so then. But be responsible for the charges, so.
Okay, I move we, accept the consent agenda.
Yeah. Yeah,
You have a second on that?
Yes,
All right.
excuse me, I'll second that. I'm back.
All right.
okay, Commissioner Clark,
Aye.
Commissioner Stewart,
Yeah,
Commissioner DiBernardo.
Yes.
Okay, I was just reading something here, I was trying to figure it out. Can I just, a real quick question to Doug? I don't know if he's still here or not.
Yep.
Doug, real quick, when you say, because I just can't remember it, and when we have total in facility is number 118, but general population is 92, what does that mean?
The other people that are between, the difference between 92 and 118 in facility would be the persons that are held in booking at the moment or segregation, like punitive segregation, or in order of numbers, it's probably in reception and diagnostic. In other words, R block, they're being processed in that first 3 to 7 day period, and they have not yet been cleared to go to general population. The next biggest subset would be the maybe 5 to 6 inmates that are in punitive segregation status. And the least of it would be they're in booking and they have been booked in, but they are literally in process. And that's a matter of 30 to 60 minutes. They could be held in a cell in booking, and that would count them in the total number, but not count them in the general population.
Okay, I appreciate that. I was having a senior moment, I think, because I could not remember for the life of me that, so thank you.
Thank you.
Yeah, it gets worse.
Yeah. All right, we've had a good general discussion for commissioners. There is no non-public, so it'd take a motion to adjourn.
Actually, just a quick thing on the calendar. Sorry, very fast. April 16th, is canceled. And next week I will have a,
you mean the commissioners meeting?
yes.
Thank you.
Is this the Primex thing?
Yeah,
It's the
exactly.
Primex training.
Right,
I never got anything back. We
I
have to
didn't
talk-
either.
We have to talk to Rob because this is getting,
We're talking about two different things here.
oh, I'm sorry.
No, you're fine. April 16th is just, the training we're having in town.
At the showroom.
And then everyone needs a Primex account to register for the May 14th and May
Oh, that's
15th.
May. Oh.
Exactly, but it's almost on the same day, so don't worry about it.
Yeah.
And that we need to have out, so just
We're-
cancel the 16th and I'll give you a calendar.
No,
next week.
April 16th is the training that we partnered with Primex on, and also the Richards Group. It's the morning I think it starts at 8:30 and goes until noon. And you have a little light breakfast in the morning if you get there early enough, and then box lunch to go out the door with, and it's leadership training. We partnered with the city of Keene on this. We also have invited SAU 29. We also invited some other SAUs and also towns
And it's held where?
at
Here.
the showroom which is behind the Colonial Theater. So your best bet, if I were you and you were looking for a place to park, I would park, if I was the 3 commissioners, I would park in our Latches parking lot. And if you pull in the Latches parking lot, there's some parking lots that are straight, or you can pull in to the left and just park there.
What is the lunch parking lot?
Behind
You'll see-
Lindy's.
Behind Lindy's, and you'll see that
I don't know what Lindy's is.
it's a diner.
Oh,
Now, yeah, you just, no, I'm gonna park it at County Hall and walk.
I can
It's
also-
only 2
I can
blocks.
show you next week, because my final point was we will be at County Hall next week. So,
Yeah,
could walk down afterwards if you wanted.
yeah, we can show you too, but it just
Starts at 8:30.
it starts at 8:30 at the showroom. And we had hoped to get at least 80 people into the training. Right now, we're right around 100.
What is the showroom?
The showroom is, this brick building that's behind the Colonial Theater.
It's a theater.
And it is a smaller venue that they bought the
It's
building.
called the showroom.
It's called the showroom.
So I'll see the
Ah,
sign.
showroom.
Commercial street parking lot?
Showroom. It's called showroom, not the showroom.
Shogun?
Like Duffy.
Shogun?
Turn up the hearing aid.
We're headed to Japan, yeah.
Yeah, that,
Are, we're still recording.
Yes, we are.
yeah.
Oh, no, I think that was a.
Need the evidence.
All right. So motion to adjourn at this point before we get ourselves in any more trouble. Yeah. Commissioner Clark,
Yes.
Commissioner Stewart,
Yes.
Mrs. DiBernardo.
Yes.
And